So in this section, I'm going to talk a little bit about normative and opposition discourses. The governing bodies that had worked with this young person had not taken into consideration the young person's experiences as an Indigenous person, a person who experiences mental illness, a person who experiences homelessness, nor the context of what that means to access institutions of healthcare and justice from coming from those positions. I had not considered his past experiences with these institutionalization spaces as a person in addiction and a person with mental illness, and how his relationship to shame and power would look quite a bit different in these spaces opposed to someone who is maybe white and considered able-minded and considered to be a different sort of citizen. His self-knowledge and personhood could be seen as being at war with these sites of power that saw him as less than, or that wanted to constrain him. For example, his physical self and his personhood were not respected or heard when the police deemed him a criminal because of his desire to die and to not continue living in a system that perpetuated his otherness. At the site of otherness, there included a construction of a homeless body, a mental ill body, and a body of addiction. As we can look at it from postmodern position, we can recognize that these bodies are constructed within the domain of power and knowledge. Thus, his engagement with the experts, such as doctors and nurses and police officers, were coming from a particular place that saw him a particular way that likely moved away from respecting his autonomy. In thinking about the value and respect for others and their inherent dignity, we can see that this is a situation where the community did not treat this young man with dignity. The power of the normative discourse is a power that perpetuates the youth's otherness in a way that did not give voice or consideration to the multiple sites of oppression that he experienced, and did not require any consciousness from the social worker, youth worker, or other community members, as the systems that they engaged in and the way that they engaged was supported by a modern discourse. The modern discourse ignored the influence of neoliberalism that saw the youth not as a citizen or as a community member that required care, but as a consumer of healthcare and criminal justice services in which those things could be revoked because they were a service rather than a right.